The Navy Physical Fitness Assessment consists of a medical screening, body composition assessment, or BCA, and a physical readiness test. This video demonstrates official procedures for conducting the BCA. It is the Command Fitness Leaders, or CFL's, responsibility to measure body composition of all sailors within the command while upholding the integrity of the program. Any attempt to influence the BCA measurement through intimidation, coercion, or other means by command members may result in disciplinary action under the Uniform Code of Military Justice. Every member is required to have only one BCA measurement per Navy Physical Readiness Test, or PRT, cycle. Also remember that passing the BCA only clears a member to participate in the PRT. The official BCA is final and will not be reversed by a subsequent BCA waiver. Members must address any potential medical issues prior to the official BCA. Per OPNAV Instruction 6110.1 Juliet, only certified CFLs or assistant CFLs are authorized to conduct official BCA measurements. There are only two approved methods to determine a member's BCA: maximum weight for height and circumference measurements. The official maximum weight for height screening table is available in OPNAV Instruction 6110.1 Juliet. Members are authorized to conduct the weight for height assessment in the uniform of the day or the Navy Physical Training Uniform, or PTU. Shoes will not be worn. A minimum of 2 CFLs or assistant CFLs are required to be present for conducting official BCAs. No single person behind closed doors or private BCA measurements are authorized. Height is measured first, standing on a flat surface facing forward with a line of vision horizontal and the chin parallel to the deck. The body should be straight but not rigid. The CFL will record the member's actual height on a score sheet. When looking at Table 1, Enclosure 3, round up to the nearest inch. The results will be used to determine the member's maximum allowable weight based on the official maximum weight for height screening table. The weight measurement is then taken on a calibrated balance beam or digital scale. The measurement will be recorded to the nearest pound. If the weight fraction is less than a half pound, round down to the nearest pound. If the weight fraction is a half pound or greater, round up to the nearest pound. No deduction for clothing is permitted. Refer to the center column of the maximum weight for height screening tables. Locate the member's height with fractions rounded up to the nearest whole inch. The official determination is made by entering measurement data into the Physical Readiness Information Management System, or PRIMS. If the member's weight is less than or equal to the maximum weight listed for their gender, they are considered to be within BCA standards, and a percent body fat determination is not required. If a member exceeds the weight for height screen, the circumference technique is required and a slightly different procedure will be used. BCA circumference measurements must be conducted in the Navy PTU. When performing the circumference measurement, round the member's height to the nearest half inch. If the member's height is 67¼ inches, 67½ inches will be used for the circumference measurement. All measurements are taken on the right side of the body with the tape parallel to the deck. When measuring circumferences, apply the tape measure so it makes contact with the skin, conforms to the body surface being measured, and does not compress the underlying soft tissues. Circumference measurements are taken 2 times sequentially and recorded to the nearest half inch. If one of the two measurements differs by more than 1 inch, the CFL will take an additional measurement and compute a mathematical average of the two closest measurements to the nearest half inch and record this value. BCA circumference measurements for men are to be taken at the neck and abdomen. Neck measurements shall be taken on bare skin at the point just below the larynx, or Adam's apple, and perpendicular to the long axis of the neck. Do not place the tape measure over the larynx. The member will look straight ahead during measurement with shoulders down and relaxed, not hunched. The tape will be as close to horizontal as anatomically feasible. The tape line in the front of the neck should be at the same height as the tape line in the back of the neck. Care should be taken so as not to involve the shoulder neck muscles in the measurement. Round the neck measurement up to the nearest half inch and record. For example, round 16¼ inches to 16½ inches. Abdomen measurements are taken on bare skin, across the belly button, and with the member's arms down on the sides. If redness and lines in the skin are observed, turn the member away for 72 hours. Take measurements at the end of a member's normal, relaxed exhalation. Discourage the member from holding their breath by taking the measurement after several exhales. Round the abdominal measurement down to the nearest half inch and record. For example, round 34 3/4 inches to 34 1/2 inches. To calculate male scores, subtract the neck measurement from the abdomen measurement to determine the circumference value. Then refer to the body fat estimation chart for final results. BCA circumference measurements for women are taken at the neck, natural waist, and hips. Neck measurements are taken on bare skin at a point just below the larynx and perpendicular to the long axis of the neck. Member looks straight ahead during measurement, with shoulders down and relaxed, not hunched. Natural waist measurements are to be taken on bare skin at point of minimal abdominal circumference, usually located about halfway between the navel and the lower end of the sternum or breastbone. When this site is not easily observed, take several measurements at probable sites and use smallest value. Ensure the tape is level and parallel to the deck, and make sure the member's arms are at their sides. Take measurements at the end of a member's normal, relaxed exhalation. Round natural waist measurement down and record to the nearest half inch. For example, round 28 5/8 inches to 28 1/2 inches. Hip measurements are taken over the Navy PTU shorts. Control top pantyhose, spandex tights, and other shaping garments are not allowed to be worn during measurements. Tight-fitting rubberized foundation garments or exercise belts are also prohibited at least 30 minutes prior to measurement. Measure hip circumference while facing member's right side by placing the tape around the hips so that it passes over the greatest protrusion of the gluteus muscles. Make sure the tape is level and parallel to the deck. Apply sufficient tension on the tape to minimize the effect of clothing. Round hip measurement down to nearest half inch and record. For example, round 44 3/8 inches to 44 inches. Add waist and hip circumferences, then subtract neck circumference to obtain member's circumference value. Use the percent body fat estimation for women in Table 3 to locate the column which matches the member's height, rounded up to the nearest half inch, and the row which matches the member's cumulative circumference value, rounded down to the nearest half inch. Follow applicable column down and row across until they intersect. This number represents member's estimated percent body fat. Note that this is only an estimate. The official BCA determination is made by PRIMS after entry. The maximum allowed Navy fat limits are 22% for males under age 40, 23% for males over age 40, 33% for females under age 40, and 34% for females over age 40.